My name is Jacob Kneeman, and as a board-certified pain medicine physician, I made this video to review when to avoid physical therapy for low back pain. You can expect to learn 5 evidence-based reasons that explain exactly when physical therapy can actually make your low back pain worse. If you've been through physical therapy or about to start it, and if you're dealing with chronic low back pain right now or have in the past, you need to watch this entire video because this information could save you months of wasted time, money, and potentially prevent further injury. Hit that like button below and let's dive in. Reason number 1, the acute inflammatory phase. A patient comes in with brand new acute low back pain. Maybe they lifted something heavy, twisted wrong, or woke up just in severe pain. Oftentimes, their first instinct is, oh, I need to get to physical therapy right now. But here's what the research actually shows. A 2019 systematic review in the Journal of Pain Research found that early mobilization within the first 72 hours of acute low back pain can actually prolong the inflammatory response and delay healing. I had a patient last month, let's call him Mike. He threw out his back moving furniture. Instead of resting during that crucial inflammatory phase, he went straight into physical therapy that same day. 3 weeks later, he was worse than when he started. Why? Because his body was still in that acute inflammatory state. During acute inflammation, your body is trying to heal damaged tissue. Aggressive movement and stretching can actually disrupt this process. The data suggests waiting around 72 to 96 hours, or 3 to 4 days, before beginning any structured exercise program. Reason number 2, a psychological roadblock. Now, this is where things get really interesting. A fascinating 2021 study in clinical rehabilitation found that patients who attended PT sessions while experiencing high pain catastrophizing levels showed increased pain sensitivity and decreased function over time. Whoa, Dr. Neiman. What is catastrophizing? Well, it's when your mind gets stuck in worst case scenario thinking about your pain. I'll give you an example. You might think, this pain means I'm permanently damaged. Or, if I move wrong, I'll make this so much worse, I'll never recover. Or, here's another example, this pain will just ruin my whole life. You're not just feeling the pain, you're also catastrophizing about what it means and where it's heading. Lots of patients in chronic pain experience this. And it's not your fault. It's your brain just simply trying to protect you. Reason number 3, a hypersensitive nervous system. This is probably the most misunderstood concept in chronic pain management. And it's why I sometimes tell patients just to stop physical therapy entirely. A landmark study in the Pain Medicine Journal showed that approximately 40% of chronic low back pain patients have central sensitization, meaning that their nervous system has become hypersensitive and simply amplifies pain signals more than really that's needed. Like, I'll give you an example, like a car alarm that's become so sensitive, it just goes off when a leaf falls on the hood. I remember one patient I had, we'll call her Sarah, 45-year-old teacher who'd been doing physical therapy for 6 months. Every session left her in more pain for days afterward. Why? Why does this happen? Well, here's what's happening. In central sensitization, your brain and nervous system have learned to interpret normal, safe movements as dangerous threats, all because of how intense the pain has become. Traditional physical therapy exercises can actually reinforce this alarm system, teaching your brain that movement equals danger. This creates more catastrophizing thoughts, which then promotes fear of movement. Research from the University of South Australia shows that for these patients, movement-based therapy can actually increase pain catastrophizing and fear avoidance behaviors. So look, the key insight is if you're experiencing widespread pain, sleep disturbances, and emotional changes alongside your back pain, you might have central sensitization or just a very sensitive nervous system. In these cases, addressing the nervous system sensitivity, first through techniques like pain neuroscience education and cognitive behavioral therapy, basically which help retrain how your brain interprets these signals, is actually more effective than jumping into physical exercises right away. Reason number 4, structural issues that exercise simply cannot fix. I'm going to come right out and say it. Sometimes physical therapy is like trying to fix a broken foundation with better furniture arrangement. A 2020 study in the Spine Journal followed 312 patients with confirmed structural abnormalities like severe spinal narrowing, large disc herniations, and spinal alignment deformities, or even instability. After 12 weeks of physical therapy, only 23% showed meaningful improvement compared to 78% who underwent other medical interventions. I had a patient with severe spinal narrowing, which basically is akin to threading a needle through a straw that's been pinched nearly shut. No surprise, no amount of core strengthening was ever going to open up that spinal canal. She spent 8 months in PT before getting progressively worse, and finally, until the structural issue was actually addressed. The research is clear. When you have significant structural compression, whether it's bone spurs, severe disc herniation, or spinal instability, exercise alone often cannot provide adequate relief. In fact, certain movements can actually worsen the compression. Red flags that suggest structural compression issues include pain that worsens with walking but improves with leaning forward, severe leg pain with weakness and numbness, or pain that's worse in the morning and doesn't improve with movement. Reason number 5, the movement paradox, when less is actually more. This final point challenges everything we've been told about when it comes to staying active for low back pain. A groundbreaking 2022 study in the Pain Journal compared 2 groups of chronic low back pain patients. One group did traditional exercise-based PT, while the other practiced strategic rest and activity pacing. Guess what? The strategic rest group showed actually 34% greater improvement in function and pain scores compared to the other group. I've learned that some of my most successful patients are really the ones who learn to listen to their bodies rather than just simply push through the pain all the time. Traditional physical therapy often can follow a quote, more is better philosophy. More exercises, more repetitions, more intensity. That all sounds good, right? But emerging research suggests that for certain chronic pain patients, this approach can actually perpetuate the pain cycle. Studies on activity pacing show that patients who learn to balance activity with strategic rest often achieve better long-term outcomes than those who push through pain consistently. I had a patient who was doing physical therapy exercises for 2 hours daily, convinced that more effort meant just faster healing. When we reduced her routine to 15 minutes of gentle movement and focused on nervous system regulation, her pain decreased by 60% in 6 weeks. Let me be absolutely clear. I'm not anti-physical therapy. In fact, PT can be incredibly valuable for many conditions and many patients. I've actually seen it myself. But what I am against is the one-size-fits-all approach that ignores the complexity of low back pain and chronic pain. If you're experiencing acute inflammation, worst-case scenario thinking about your pain symptoms, a hypersensitive nervous system, or structural issues that need medical intervention, it might be time to pause and reassess. As someone who's treated thousands of patients, I've learned that sometimes the most therapeutic thing we can do is stop doing the thing that's not working. If this resonates with your experience, I'd love to hear about it in the comments. Have you found that physical therapy made your pain worse? What approaches have actually helped you? And if you found this information valuable, please hit the like button and subscribe. I'm committed to sharing evidence-based insights to help you manage your pain. Remember, you know your body better than anyone. Trust your experience, seek multiple opinions, and don't let anyone convince you that pain is just something you have to push through. See you in the next video.